Hello everyone and welcome back to my YouTube channel. My name is Surina and I trained as a doctor in the UK, but I'm currently working in Brisbane, Australia. My day begins at around 6 AM when my alarm goes off and I snooze it several times before rushing around and getting ready for work, and then I head off to the bus stop where I inevitably run for the bus every morning, no matter what time I leave. I'm currently on a breast and endocrine surgery job and the day begins at around 7 AM when we meet in the common room to start our ward round. Breast and endocrine surgery doesn't usually have many inpatients, so our ward rounds aren't usually very long. I start the day sorting out some routine ward jobs such as discharge summaries and medications. Once I'm done with ward jobs, I go and get changed to go straight to theatre to help out in a morning list where we are removing some breast lumps, a procedure known as a wide local excision. Firstly, the patient goes to the radiology department where the lump is localized using imaging and a low-dose radioactive seed is inserted into this area. Later, in the operating theatre, we localize this lump by using a special detector to detect that clip so the surgeon knows where to cut out the lump from. This excised tissue is sent back to radiology so that they can image it to find the clip and confirm that the correct piece of breast tissue has been removed. One of my jobs is to take this excised tissue to radiology and observe it being imaged and confirm with the radiologist that the clip is in the lump. After this, it is sent to the histopathologists who look at the tissue under a microscope and determine whether it is cancerous or benign. After a couple of these cases, I have a quick lunch and then head back to theatre, this time to scrub in for a case where we are removing the whole breast rather than just a lump, in a procedure known as a mastectomy. This can be done for a number of reasons, such as a very big lump, multiple lumps, or the patient's choice. After this case, I run down to the breast outpatient clinic to help my colleagues see the last few patients so that we can all finish on time. After this, it's time for the afternoon ward round where we check in on the patients we operated on that day, and then I get changed to go home. So filming days in the life at the hospital seems like a reasonable idea until I realise how impossible it is to film in hospitals. So I'm feeling extremely weird sitting in the corner here trying to talk to a camera and hoping I don't see anyone I know or work with. It is almost 6:30 in the evening, so hopefully everyone's gone home. I feel so nervous. Yeah, that was a pretty typical day on breast surgery. A little bit of surgery, a little bit of clinic, admin, ward rounds, all the good stuff. Actually, it was a really good day because my consultant let me close on the last case, so that's always exciting. I'm gonna go home now, I'm absolutely starving, and I'll check in with you tomorrow. Another day, another morning rush. If only I could get ready this quickly. After a foggy walk to the bus, I get to work and meet my team for another morning ward round. Today's ward jobs include popping in a cannula for a patient having antibiotics and changing the dressings for a patient whose drain site has leaked a little overnight. After this, I actually have a bit of downtime during the morning, which is very much needed as I have a few admin tasks I need to catch up with, such as preparing the patient list for the multidisciplinary team or MDT discussion. This is a weekly meeting that involves different teams such as the surgical team, oncology team and radiology team to discuss various cases and come up with the best treatment plans for our patients. Then it's time for a weekly teaching session where we go through radiological images and histology results for various surgical patients in the hospital that week. In the afternoon, it's back to clinic, this time for endocrine surgery patients. This generally involves seeing patients with thyroid lumps, overactive parathyroid glands, and occasionally lumps on their adrenal glands, which may or may not need surgical removal. Good news is that we finish at a reasonable time that afternoon, but bad news is that I somehow got on the wrong bus, have to get off at another stop and walk home instead, but luckily it's a pretty beautiful evening for a walk. The next day is a pretty full-on all-day clinic, but my registrar offers to buy us all coffee in the morning, which significantly helps to get through it. I spend the morning seeing post-operative endocrine patients, so mainly patients who have had total or partial thyroidectomies, and we are now checking their surgical site, all the thyroid hormone levels in their blood, and ensuring they are not having any speaking or swallowing issues. Our morning and afternoon clinics are back-to-back, so clinic snacks are essential. But thankfully I managed to slip out for a very quick lunch just before the afternoon patients start to arrive. After clinic, there is a patient to see in the emergency department who is presented with a red and painful surgical site and fevers following a wide local excision she had a week prior. As we are concerned about a wound infection, I take some blood tests looking for markers of infection and inflammation, prescribe some pain relief and some intravenous antibiotics. I also book the patient for an ultrasound scan to look for any infective collections that have built up under the wound site and can be drained to help clear the infection. Guys, I am tired. Did not sleep well properly last night at all, and today's ended up being a bit of a long day. But having emergency admissions is a very common part of most jobs in the hospital. It takes up a lot of time, but not too common with breast surgery, another reason why I like it. So yeah, we did have 2 admissions today, which took a bit of time to sort out, but it's not a common thing, especially compared to other surgical specialities. I'm gonna go home and eat now. I actually have Thursday off, which is nice. If you want to see more of what I do on my days off in Brisbane, check out some other videos on my YouTube channel. And just like that, it's finally Friday. Some of my seniors are rotating to new jobs, so I bring in some brownies I baked on my day off to say goodbye. The day starts with the usual ward round and ward jobs, and then, yep, you guessed it, it's time for more clinic. What this speciality lacks in inpatient workload, it definitely makes up in the huge volumes of outpatient workload. Whilst I perform the holy healthcare worker ritual of waiting for the computer to load, I sample some of my baking with some coffee courtesy of my consultant who has treated the whole team today. Not bad. We are consulting patients both face-to-face as well as over the telephone in clinic. A common face-to-face appointment in the breast clinic is for patients who have been found to have a new breast lump. These patients undergo what is called a triple assessment, made up of a clinical examination, some imaging such as ultrasound or mammogram, followed by a biopsy of the lump, where some cells are tested to see if this lump is most likely benign or cancerous. By the time we see these patients, they have usually had their triple assessment facilitated by the GP or the breast screening program, and we meet them to take a fuller history, confirm and discuss their results, and determine next best treatment steps. Breast cancer is now hugely treatable if detected early, so this is a quick public service announcement to remind anyone with breast tissue to check their breasts for abnormalities regularly so we can investigate nice and early. Hey guys, just finishing up on this Friday morning clinic, and pretty respectable time, it's just gone 12:30. I do really love doing these day in the life, week in the life, work related vlogs, and I know you guys like seeing them, but there's quite a few challenges with them, with the nature of the job, but hopefully I've given you a good idea of what a week looks like on breast and endocrine surgery. I think we've covered quite a lot of things: theatres and clinics, MDT, admin things, ward rounds, emergency presentations, so hopefully you found that interesting. There's a lot going on today in that we've had the clinic this morning, and there's also 2 theatre lists going on right now, but there are registrars and medical students there, so they have saved us from being very short-staffed because the rest of us, me and my intern and another consultant, are doing clinic, and the intern has been on nights for a couple of weeks and hasn't gone to theatre in a while, so she might pop over there to help, which leaves me free this afternoon to catch up on some paperwork and stuff. I'm actually coming to the end of my breast endocrine surgery placement. This has definitely been one of my favourite jobs I've done as a doctor, which is just as well. Sorry, someone knocked on the door asking when I'll be leaving because they need this room in about half an hour for afternoon clinic. So that was a bit scary, but like I was saying, really enjoyed this job. I think what's made it so good is such a great team. It makes such a world of a difference if you get on well with your seniors and you've got a good relationship with your consultants and everyone's keen to teach and learn. Just little things like seniors buying you coffees and having lunch together, etc. makes such a difference to the group morale and how enjoyable work can be, because it is obviously pretty stressful and busy at times, but a lot more enjoyable if you get on with everyone. If you want to see other days in my lives, I have done a couple here and back in the UK, and I'll see you in the next video. Thanks for watching. Bye. Hey guys, another outro from me, because it turns out my quiet evening of admin didn't quite go to plan. The theatre lists were both running late, and the medical students had been there all day, so they needed relieving. So they asked for me and the intern to come, which we did, and I don't want to go into too many details, but essentially there were some unexpected findings with one of the patients, which meant the case ran on longer than it usually would, and it's almost 7 p.m. now. Just at the bus stop waiting to go home and have some takeaway, which I'm very looking forward to. But yeah, that is the nature of the job. Sometimes these things happen. Thankfully, on a speciality like breast surgery, it doesn't happen too often. I'll be back tomorrow, sadly. I'm on this weekend, but thankfully they're just half days, so it shouldn't be too bad. And yeah, thanks for joining me on this week. I hope you found that interesting, and I will see you in the next video. Bye!